Welcome to our second keynote, Taming the Medical Record Dragon. Now, we have been using text to record things for as long as there's been the written word. And especially in the medical field, this is true. But what if these texts were able to be made into data so we could use it for so much more? Here to talk about that solution from Forest Rim Technology, Bill Inmon.
Thank you. It's a real pleasure and honor to speak with you today. I hope you find the topic that I'm speaking on to be of interest and to be of use. If so, I've done my job today. It's kind of interesting. Text has been the Wednesday's child of the world, that it's always been there, but people haven't paid much attention to it for a lot of reasons. The technology is not particularly easy to use. Text, when you get into it, is terribly complex. We take it for granted because we speak every day, but trying to teach the computer how to understand text is a whole different task altogether. So today I want to talk with you about one of the many applications of taking text and turning text into something useful. So let's talk now. Start with our conversation about text and the world of medicine. The other day, I was in my doctor's office, and he asked me what did I do for a living, and I said to my doctor, he said I read text and turn text into a database, and he said, "Gee, that's kind of interesting. I've never known anybody to do that. Why would a person want to do that?" And so I said to my doctor, I said, "Sir, let me ask you a question. You've been practicing medicine for a long time now, and what happens when you get a patient with an unusual set of conditions?" And he says, "Well, if that happens, I go out and I try to find out what other doctors and other patients have done and find out what's been successful, and that's what I use to guide me to tell how to handle my patient." And I said to him, "Well, that's kind of interesting. In your career as a doctor, how many patient records have you ever read to try to find out what's going on in your with your patient?" And he says, "I don't know." He says, "Maybe 20 or 30 records." And I said to him, I said, "Well, how would you like to be able to read 1,000,000 records? Wouldn't your patient stand a better chance of having an outcome that's successful?" And he said, "Bill, I can't read a million medical records." And I said, "I know you can't, but the computer can. And once you put the computer to work reading all of those records, then you can start to do research like you've never done before." So what we found is that we have medical records. And when you take a look at the world's medical records today, the truth of the matter is medical records are designed to handle a single patient and a single doctor. They're for the most part in the form of text. And what you find is that trying to do medical research is entirely different than trying to look at a single medical record and find out what's going on. The medical records, the EHR or EMR as we call them today, were never designed for medical research. And so what we find is that there is technology today that I'm going to be talking about that allows you to easily and quickly take your medical records and put them into the form of a database. And what this means is that instead of looking at 10 or 20 medical records, now you can look at 1,000,000 medical records. And furthermore, you can do so inexpensively, simply, and easily. The technology is designed to be easy to use. So what we need to do is to look at the technology. Now, there are other technologies out there that are very difficult, very cumbersome, and very complex to use. They take a lot of time, they take a lot of money, to try to understand the text. I'm not talking about that technology now. I'm talking about a different technology that is easy, fast, simple, and inexpensive. All of the things that an organization would like to be able to do when they are needing to look at medical research. Now, one of the problems that you run into in medical research is there are many specialties, and each of these specialties has their own vocabulary. And so, one of the things that you need to do is to make sure that you can handle all of the specialties. There's nephrology, there's cardiovascular, there's all sorts of medical technologies. So, if you're going to be reading medical records, you need to be able to handle all of the specialties that there are in medicine. So, that's one consideration of what needs to be done when you read medical records. You need to be aware of the fact that there are different specialties, that each of which has their own terminology. And that is something that is not a small task to be able to do that. But there are other things that you need to be aware of, and that is that when you get into medical technology, doctors are fond of using acronyms. Rather than write out a long word, they simply will shorten it to 3 or 4 letters. And so when you're reading doctor's notes, you need to be able to read, understand, and interpret those acronyms. Now, acronyms are kind of a special case because not only do you have acronyms with medicine that you have to worry about, you have the fact that in some cases, the same acronym appears in different specialties with a different meaning. That somebody in cardiology will call an acronym one thing, and another person in endocrinology will call the same acronym something else. So if you're going to be successful in reading medical records and interpreting them, not only do you need to be aware of the fact that they're acronyms, you need to be aware of the fact that acronyms have different meanings for different specialties. So I'm going through with you now some of the challenges that have to be overcome if you're serious about reading medical records for the purpose of research. By the way, let me stop just for a second. We have dealt with a number of organizations, and when you get into medicine, there's really two sides to medicine. There's the clinical side, there's the research side. On the clinical side, this is where the doctor is treating a single patient and wants a single answer. And that's typically called clinical. And that's the bedside activities that a doctor does when he or she is treating you. But the other side of medicine is the research side. And who does the research side? The people that do the research side are people such as pharmaceuticals, healthcare organizations, governmental healthcare organizations, and so forth and so on. We've looked at the technology of textual ETL, and as far as we can tell, it's difficult to apply textual ETL to the clinical side of medicine, but it fits very naturally and very easily for medical research. So some of the other considerations that you have, and this is one of the more insidious of those considerations, is the fact that in medicine, the same thing often has multiple names. For example, there is a medicine called furosemide that also has a whole host of other names. In some places, furosemide is called Lasix. So it depends on whether you're talking to a hospital or to a private physician, whether you're in England or whether you're in the United States or some other country, that there is a whole host of terminology differences in language. And to be successful in reading medical records, you need to be able to normalize your data. You need to be able to say, okay, I'm going to call my medicine Lasix, and I'm going to do my research on Lasix. But when I read furosemide, I need to be able to take my furosemide and have that come out in my research data as Lasix. So there's this terminology difference, and it's not just among hospitals and practitioners and clinics and things like that. It's among different parts of the world. In England, they'll call something one thing. United States, they'll call it something else. In Brazil, they'll call it yet something else. And so, in order to do research, you've got to be able to normalize your data so that you call it a single thing. Otherwise, you can't do research on it. And so, one of the nice things that textual ETL can do is to be able to create a single understanding of what an object is and be able to translate all other occurrences of that object into the one that's been decided on. And that's a rather important concept in the world of medicine. If you're going to be doing research, you need to have a single foundation of data on which to do it. Otherwise, your research will, pardon me, otherwise your research is going to be very difficult to do. So some of the other considerations of medical research, and this is one that's imposed on us by our governments, and it's found in one form or the other pretty much around the world. And that is that government agencies don't want us doing medical research. They have enacted laws of protection for the individual that greatly inhibit the capability of doing research. So unless your organization wants to be fined lots of money and get in trouble, you've got to be able to de-identify, pardon me, you need to be able to de-identify your data before you can ever do anything with it. So another challenge of dealing with and managing medical records is the challenge of being able to de-identify the data. I don't know of any organization anywhere that wants to run afoul of the rules of what their government has imposed on them. I don't know if you know the story of how de-identification got to be the issue that it is, but in the United States, a number of years ago, at a very large insurance company, somebody, I don't know who it was, did something that was horrible. They went in and found the names of people that had been identified as having HIV virus and made that list public. Well, that was something that was a terrible thing to do. But what happened is the government of the United States agreed that's a terrible thing to do. So let's now protect medical records. And from the standpoint of protecting people, that was a good thing to do. However, by creating these draconian laws for patient protection, they made medical research very difficult to do. And so the government protected the citizen, and that's a good thing, but they did so at the expense of doing medical research. So when you're going into looking at medical records, one of the things that you need to think about is how do you de-identify your data before you ever start to do research on it? And this turns out to be a really complex topic. And if anybody's really interested, I can tell you all about it because we had to build this capability. But de-identification of medical records is something that is an essential part of being able to manage your data. So what do we have now? Uh, uh, we have technology that easily, quickly, and inexpensively allows us to take our medical records, put them into a database. And so, how long does it take to do medical record analysis and conversion, transformation to a database? Well, that depends on your medical records. In fact, just the other day, I had a physician give me a medical record that was 80 pages long. And it took us a while to go through 80 pages. Now, some medical records are very large and some medical records are not. Most medical records are, oh, I don't know, 4 or 5 pages, something like that. Some medical records are much larger. So that when people ask us, how long does it take? It really depends on your medical record itself. If you've got a medical record of, say, 100 pages, it's going to take a while to create your database for that medical record. But if you've got a normal size medical record, 3 to 4 to 5 pages, something like that, then it's going to take a very short amount of time. We typically tell people that once we get your data into the machine, it may take for a normal size medical record 3 or 4 seconds to create your database. If you've got a larger one, it's going to take longer. And how much does this cost? Well, it depends on how many records you have, what machine configuration you have, and so forth. But typically, the cost is anywhere from 10 cents to $1. So it's and that would be United States money. And so you find then that it is inexpensive to go in and create your medical records. So the cost and amount of time is something that you needn't worry about. Now, how long? What does it look like once the database is created? Once the database is created, there are a lot of components. I'm only going to mention a few here, but one thing is we have the word that's been found, and that's one thing that has to be in there. We have the location and byte address of the word. So if there's ever a need to go from the word that's found back to the original source, it's a very easy thing to do. And then we have context. So we have the context of the word as it's found, as it sits in text. Now, there are other things that go into the database, but from a database standpoint, this is what your medical record looks like. And it's kind of interesting. When you look at this, this looks like a very simple thing to do, but there's something profound that's occurring here. And what's occurring here that's profound is the fact that once your record is in this form, you can now analyze millions of records. As long as your records are in the form of text, you can only analyze what a human can read and a human can hold in your brain. So this little slide here doesn't look very glamorous until you consider the effects of what this slide means. That this is the key to opening the door to being able to analyze a whole host of records. So what can you find when you are looking at your records? You can find anything that's in the medical record. You can find body parts. You can find medication. You can find procedures. You can find demographic information. You can find insurance information. If it's in the medical record, it can be found. And how useful is this information? Well, let me tell you, from a standpoint of research, this is extremely valuable information. So let's now talk about the information of who needs this kind of information. Well, it turns out a lot of people need this kind of information. Insurance company, people that do finance with medical records, people that want to discover the effectiveness of medicine, pharmaceuticals, All of these people need this kind of data. And so, what do we find when where the medical records come from? People say, "Well, Bill, I've got medical records in paper files. I've got medical records in Epic. I've got medical records all over." Uh, the technology I'm talking about doesn't care. The technology I'm talking about can take the medical record from any and all of those sources. In fact, another nice thing that can be done once you can do this is use this facility for modernizing your medical record environment. That you're able to bring together all sorts of medical records from all sorts of environments. The only requirement there is for the usage of the technology is that what you're looking for be in the form of text. As long as it's in the form of text, it doesn't matter where it has come from. So now you say, okay, Bill, thanks for telling me all about this. This is really kind of interesting stuff. What can I do with the results? Once I've created my database, what can I do? Well, here is a simple, pardon me one second. Thank you. Here is a simple example of what can be done. This is what's called a Pearson coefficient matrix, and it allows any two variables to be measured from a standpoint of correlation to any other two variables. Now, let me explain what this means. You can take, for example, COVID, and you can say, okay, for all of my patients that are out there, what are the correlations to COVID? What about obesity? What about cancer? What about heart disease? Is there a positive or a negative correlation to COVID? And you can take anything that's found in your medical record and do analytical processing from it, and you can do so instantly. Now, let me explain that. When I say instantly, I mean to go from the raw text of the medical record to an analysis literally in a matter of minutes for an inexpensive amount of money. So that's one thing. Now, we've taken the same data that we had. Let me show you. We've taken this data here, and this data here is what we call data for the technician and the analyst. This data is the same data, but it is for management to look at. Management doesn't like to look at complex, messy things. Management likes it to be neatly laid out in front of them. So if you want your data coming from your databases to look like this, then that's absolutely fine with us. We can present it. In this case, we can take such things as male and female, smoker, non-smoker, having different diseases, having different immunizations, and how do they all correlate to each other. So if a manager wants to look at the data in a different format, that's a very easy and mechanical thing to do. Another thing that's popular today is something called knowledge graphs. And we can take the data and put it in the form of a knowledge graph if that's how you want to look and analyze your data at. So there's a lot of possibilities. Once you create the database, once you've taken the data from its raw text environment and put it into the form of a database, then visualization of the data and analysis of the data becomes something that's very easy to do. So what do we have here? We have, I'm reading my slide. So what can you do with the data? Once you've done this, you can modernize your system. You can do all kinds of things with medical records once you put it into the form of a database. And so we find then that the questions that we can ask all sorts of questions. We can ask any question that relates to the data as it's found in the medical record. We can ask, what are the correlations between things? What about the number of people that had a heart problem? What about the number of people that had diabetes? How is diabetes being treated? How effectively is diabetes being treated? How effectively is heart disease being treated? These are questions that go well beyond any numerical kind of compensation. These are questions for the improvement of health for mankind. So we find then that we don't have to look at COVID. We could look at COVID, and we certainly can look at COVID if it's in the medical record, but you can look at anything in the medical record. You can look at obesity. You can look at alcoholism. You can look at diabetes. You can look at anything that's in the medical record. And how can we do this? We can do this by taking the text and putting the text into a form that's useful to and friendly to the computer. So, what about pressures? What about diabetes? What about cancer? These are the things that we can look at. So, who needs this kind of information? Well, let me tell you, folks, there are a lot of people that need this kind of information. Pharmaceuticals need it, healthcare research organizations need it, government agencies need it, doctors need it. You know, it's kind of interesting. The one community that we really haven't found a lot for, and we know it's there, we just haven't found it, is the clinical community that for the treatment of a single patient for a single doctor. We know that there is opportunity there. We just haven't found it. But for people that want to do research, looking at thousands of records, not a single record, that's the primary audience for doing what we are suggesting here. So what we're suggesting then is something that's inexpensive, fast, simple. Anybody can do it. You don't need a data scientist. You don't need the IT organization. The end user can sit down and do what he or she wants to do or needs to do with the data. It's as simple as that. So what do we find? We find right now that it's fast, inexpensive, and simple.